Hello, good afternoon, doctors. On behalf of Heathrow Healthcare, I, Dr. Prashant, welcome you to this webinar on recent advances in intimate health management. Doctor, at Heathrow, we market products in multiple therapy areas like in gynecology, dermatology, gastroenterology, orthopedics, etc. With a very strong R&D background, we try to develop products keeping patient benefit in mind. Our endeavor is to improve patient compliance and ultimately clinical outcome. We have developed NSAID patches, rivastigmine patches for improving patient compliance. Gynecology, obstetrics, and IVF is an important therapy segment for us at Frenza. Apart from oral tablets like Didropal and Mylotin, we market products for vaginal health, Feminora, and Pellitra, as you know. Recently, we have introduced a vaginal film under the brand name Celero. The film contains lactic acid along with fructooligosaccharides. The film is supposed to correct the vaginal pH and maintain it at acidic pH so as to protect vagina from infections. To speak more about the conditions requiring vaginal film product and share clinical experience, I have the pleasure in inviting Dr. Mridula Purkayastha today afternoon. Dr. Mridula Purkayastha is MD DGO from Mumbai University. Madam is Senior Consulting Gynecologist and Obstetrician in Calcutta, specialized in adolescent and menopause health, with a very huge practicing experience, practicing since 42 years. Welcome, Dr. Mridula. Welcome once again, and good afternoon to you. Over to you, Dr. Mridula.
Good afternoon. Today's topic . Hello. Today's topic is quite unique and interesting. It's recent advancements in intimate health management. Intimate hygiene is all about keeping your privates clean and hygienic. Daily gentle cleansing of the vulva is an important aspect of feminine hygiene and overall intimate health. Vaginal pH is a key. The vagina is a self-cleansing machine. Clear white vaginal discharges are normal and an indication that it is perfectly healthy. However, if the discharge is smelly of a different color like yellow or green and is causing itching and soreness, chances are high that it might be due to an infection. Vaginal flora and vaginal pH play a significant role in intimate hygiene. Vaginal flora, vaginal microbiota, or vaginal microbiome are the microorganisms that colonize the vagina. Depending on the age in a female life, vaginal flora also changes. Like from birth to first 6 weeks, there is dominance of lactobacilli. From 6 weeks to pre-pubertal age, up to puberty and post-menopausal age, lactobacilli reduce, but there is dominance of streptococci, staphylococci, enterobacteria. In healthy vagina, both good and bad bacteria coexist in balance. The primary bacteria of a healthy vagina are of genus Lactobacillus. Lactobacillus protect against pathogenic species. So it can be said that Lactobacillus is the gatekeeper of ecosystem of vagina. Vaginal pH. The acidic pH of a healthy vagina ranges between 3.5 to 4.5. The increased acidity forms a natural protective shield to prevent harmful germs and other microorganisms from intruding. A pH above 4.5 makes the vagina susceptible to vaginitis or inflammation of the vaginal tissue. Lactic acid supports the maintenance and restoration of a naturally healthy vaginal flora. The vaginal pH is therefore determined by the sum total of lactic acid production by the vaginal mucosa and microbial flora. So Whenever there is healthy vagina, there is balanced pH.
My apologies, ma'am. Can you just put it to the slideshow mode, please? I will edit this session where I intervened. Put it to the slideshow mode.
Slideshow, yes.
On the bottom right side, you see that line, ma'am, the volume line. Besides that, there's the icon. Bottom right side. Yeah, that is the one. 2 times, yes. You can just take a pause of around 2 seconds, then start talking. I'll edit this session. Go ahead, ma'am.
Okay. Production of lactic acid. Estrogen hormone has influence on vaginal mucosal membrane. It increases glycogen level in vaginal epithelium, and lactic acid bacteria produce lactic acid. Lactic acid hampers the growth of pathogenic bacteria. Colonization of lactic acid bacteria induces the growth of lactobacilli and creates an acidic environment, that is pH 3 to 4.5. That gives natural protection system which prevents infection and maintains vaginal health. Lactic acid produced hampers growth of pathogenic bacteria, colonizes more lactic acid bacteria, induces more lactobacilli growth, and creating an acidic environment of pH 3 to 4.5. And it also helps in regulation of vaginal pH. The normal vaginal flora, acidic vaginal pH, and vaginal discharge are all components of the innate defense mechanisms that protect against vulvovaginal infections. Coming to pathophysiology of disturbed, excuse me, I have to go back. Sorry, now it's okay. Pathophysiology of disturbed vaginal health. These factors like age, lifestyle, etc., they decrease the vaginal lactobacilli. And that decrease in concentration of hydrogen peroxide and lactic acid. Almost 96% of lactobacilli produce hydrogen peroxide, and it's a broad spectrum antimicrobial. So when there is decrease in concentration of hydrogen peroxide and lactic acid, there is raise in vaginal pH, which increase in overgrowth of pathogens and which can lead to vaginal infections, causing vaginal discharge, tissue odor, and may lead to infertility and sexual transmitted diseases. Symptoms of unbalanced vaginal pH. Strong fish-like smell, gray-green or foamy vaginal discharge, itching around the vagina, swelling and irritation around the vagina, pain or burning feeling in the vagina during sex, or burning sensation while urinating. Coming to causes of disturbed vaginal pH. There are various causes like during menstrual cycle, blood has pH of 7.4. So during menstrual periods, pH is elevated. Most women's bodies can handle the difference, but some find that they are prone to infection during or after menstruation. Medication. Antibiotic medication can raise vaginal pH because it kills all bacteria, both good and bad. Birth control pills can also change vaginal pH for some people, which potentially leads to infections. Douching. Douching is a method of cleaning the inside of the vagina. It's different from the washing the outside of vaginal area with soap and water. Douching usually involves squirting a pre-packaged fluid mixture into the vagina with a tube or other tool. This process can raise the vaginal pH. Lubricants. Lubricants reduce dryness in the vaginal area during sex. Some lubricant products have a pH higher than 4.5. This higher pH can kill healthy bacteria and lead to an infection. Breastfeeding or menopause. Hormones, especially estrogen, play a large part in keeping the vagina healthy and the pH acidic. When women breastfeed or start menopause, estrogen levels are low, sometimes resulting in conditions like vaginal atrophy and causing
ग्लिच आ रहा है क्या बार बार बीच में?
current treatments. Antimicrobial therapy. Clotrimazole as a topical imidazole, a drug of choice for vaginal yeast infections. 1% cream daily for 7 to 14 days, 100 milligram insert daily for 7 days, or twice daily for 3 days, 500 milligram insert once. Miconazole as a topical imidazole, a drug of choice for vaginal yeast infections. 2% cream daily for 7 days, 100 milligram insert daily for 7 days, 200 milligram insert daily for 3 days, or 1200 milligram insert once. Nystatin is the only preparation for topical use. 1 lakh injection units once daily for 14 days. Turconazole as a topical imidazole, a drug of choice for vaginal yeast infections. 0.4% cream daily for 7 days, 0.8% cream daily for 5 days, or 80 milligram insert daily for 3 days. Fluconazole, a drug of choice for vaginal yeast infections. 100 milligram tablet as a single dose. Metronidazole, drug of choice for trichomonas and bacterial vaginosis. For trichomonas infection, 2 grams once or 500 milligram orally twice daily for 7 days. For bacterial vaginosis, 500 milligram twice daily for 7 days, or 2 grams once, or 0.75% gel twice daily for 5 days. Ketoconazole, a second-line therapy for vaginal yeast infections. 400 milligram tablet twice daily for 5 days. Clindamycin, a drug of choice for bacterial vaginosis. 300 milligram tablet twice daily for 7 days. 2% cream once daily for 3 to 7 days, or 100 milligram ovule once daily for 3 days. So these are all the available therapy, but they give temporary relief, cannot give long-lasting results. So there are certain gaps. Lactic acid wash out even good bacteria, lack adherence to vaginal surface. Suppositories, leakage issues due to use of high suppository bases and inconvenient. Vaginal gels, messy application, accurate drug delivery not possible due to sticking of gel on hands or applicator. Soft gel capsules or ovules, patient discomfort due to non-flexibility of material. So there is a need of right therapy option for sustainable result in balancing the vaginal pH. So lactic acid vaginal films are now available in the market. Advantages of lactic acid vaginal films: longer residence time or adherence time due to use of bioadhesive polymers, lack of leakage, patient comfortability due to film flexibility, convenient application, faster drug release, increased stability at the extreme storage conditions, and easy storage. Hetero Healthcare, pioneer in vaginal care, knows the best and offers the best to bridge the therapy gap, a revolutionary therapy in vaginal care management to balance the pH. First time in India. Lactic acid vaginal films. Lactic acid vaginal film contains lactic acid, which restores the imbalance of vaginal microbiota and restores vaginal pH to 3.8 to 5. Fructooligosaccharides promotes the growth of lactobacillus and secretes antibacterial substance. It balances the vaginal pH. So Hetero Healthcare has come out with lactic acid vaginal films, which are faster and accurate drug delivery, longer adherence to vaginal surface due to bioadhesive polymers. Flexible film ensures patient comfort. These films are easy to carry, easy to use, and easy to store. Dosage: 1 thin film at bedtime for 5 to 7 days. Application 1. Yes, this is regarding the instruction for use. Wash hands first. Cut the pouch from 3 sides. Roll the film on dry fingers. And in a comfortable position, insert the film into the vagina and wash hands after insertion. Thank you.
Thank you very much, madam. Thank you very much. There are a few questions. I'll just ask them to you. Madam,
Yes.
when you prescribe the film, is there something as a prophylactic use of the film to those patients who are at risk or more prone to get infections? Like, for example, a lady is going to put on a long-term antibiotic. Then is there something as a prophylactic use, or you actually use it when the patient gets infected?
No. I feel it has definite prophylactic use because this lactobacillus in the film produce friendly bacteria and maintain the pH, vaginal pH.
pH, correct. So to those patients who are at risk of getting the vaginitis, it's better that they use it for 5-7 days, whatever the case may be.
Yes.
And is there any, apart from symptomatic relief, would you use it for maximum of how many days? 5-7 days? What is the usual duration you prescribe?
Yeah, 5 to 7 days is advisable, but if at all required, it can be used for longer periods.
For a longer period also.
Yeah.
Anyway, it's only lactic acid.
Yeah.
Does this vaginal wash which are available, do they irritate the vaginal lining?
They are actually used for the comfort. So there is no question of irritation. At times, if anybody is allergic, may get irritation. But in general, they are used to avoid unexpected odor also.
Yeah. Although we suggest you use it at night, is it okay to use the cellular film during daytime?
Yeah, it can be used during daytime as well as nighttime.
Correct. And now that you have prescribed the cellular film for quite many patients, what is patient's experience about the film?
Yes,
what do the patients say?
Yeah.
Yes, what do patients say?
Got the relief. Patient is happy about it.
But do they find it easy? Do they find it easy to use, or what is their like?
Yeah.
They are comfortable
it's
using.
Easy to use, and it is comfortable also. And they don't have any complaint.
There is one question. Will it interfere with post-delivery episiotomy?
No, it should not interfere. On the contrary, it will help because
Correct.
lactobacillus
By
acid
clearing
will
the things.
enhance the
Correct.
positive good bacteria and healing will be faster.
Madam, like we know that diabetic patients get this vaginitis, very common. Patients on oral corticosteroids also get it?
Yeah, patients, diabetic patients, as well as patients on oral corticosteroids are at high risk of developing candidiasis, yeast infections.
And what about inhaled
So-
corticosteroids like asthmatics?
In that case, it is advisable to give as preventive purpose.
Okay.
And whenever there is
preventive
infection,
purpose.
accordingly, the infection has to be treated. But this
Absolutely.
vaginal films has preventive role.
Would you use this film concomitantly with any other active treatment? Like, for example, you want to use a clotrimazole treatment, and would you use the concomitant?
Yes, I think so. It should be used because it will enhance the recovery.
Only the timing has to be different for both of them, topical use.
Yeah, if anybody is using ovules or gel cream, then
Correct,
after finishing
correct.
that, this can be used.
Absolutely.
The active infection will be over.
Uh,
And then it can be used.
and is it safe to practice to have intimate hygiene during early pregnancy?
Yes, there is no risk. There's no risk. Because
I think
many
that's all
patients,
from our.
many patients due to bacterial vaginosis have
Huh.
abortions or premature labors.
Oh,
So
acha.
this is, of course, very much advisable. So there is less
In
of
fact, in many of the IVF
chance.
protocols, they use lactic acid bacilli
Yeah,
before
probiotics,
the
yeah.
whole process starts. Yes, probiotics they use. Right, madam. Currently, that's all from our side. If there's something, we'll again come back to you. But it's a lovely session. Thanks once again.
Thank you.
Thank you so much. Thank you all the doctors for spending your time. Thank you.